Greetings. Let us talk about patient and equipment position for endoscopy. So, once the patient is brought into the room by the nurse, you go to the bedside, you introduce yourself, and start preparing to position the patient so that it is easy for the endoscopist. This is something that you do after you have brought the scope and set up the scope. You checked your biopsy jars, labeled them, you checked your inventory of your accessories so that you have everything set up, and then you position the patient. You position the patient in such a way that it makes it easy for the endoscopist to perform the procedure. It requires attention to three important details: height of the bed, position of the patient on the bed, monitor position, and also important to keep in mind the position of the processor and looping on the umbilical cord of the scope. So here the patient is lying on the left side in the middle of the bed. The bed is too low, and this causes a lot of strain on the back and neck of the endoscopist as he has to lean forwards. In order to minimize this problem, you should have pumped up the bed so that the height of the bed is at about less than a few degrees right angles to the elbow. And it is even better if the patient was lying on the left side close to the edge of the bed. That makes it even better for the endoscopist, especially those who do not put their scope on the bed. You also notice that the endoscopist is standing comfortably in neutral position without straining the neck and is looking straight ahead at the monitor. The monitor height is at or just below his eye level. You notice that the scope is coming, the umbilical cord of the scope is coming on the left side, and there is no looping. So this is ideal setup. For the sake of measurements, depending upon the height of the endoscopist, the bed could be anywhere from 85 to 120 centimeters from the ground, and the monitor 93 to 162 centimeters from the ground. The key is to set it up in such a way that the endoscopist is very comfortable without straining any part of the body. So let us look at some other problems if you do not set up the monitor correctly. Here the monitor looks perfect. Say for example the monitor is set at a higher level or a lower level, it causes strain on the neck. If it is set up at a higher level, the endoscopist has to look up, and it puts a lot of strain on the neck and cervical spine. If you notice that, you need to bring the position of the monitor to where it should be, at or just below the eye level. Before you start the procedure and before you give the scope to the endoscopist, you should take away all the loops in the umbilical cord. Having those loops and not removing them would cause a lot of strain for the endoscopist. It's also important to keep the position of the processor, especially for those doing colonoscopy, slightly to the back and to the left of the endoscopist. So here you can see there is a loop that produces a lot of strain on the endoscopist's shoulder and hands, and you could help the endoscopist by giving the scope straight without that loop. So as you can see here, endoscopy involves a lot of work. How you position the processor slightly to the back and to the left of the endoscopist, making sure that there is no looping of the umbilical cord. The patient is close to the edge of the bed and the bed height is at or just below the level of the elbow, flexed at 90 degrees. The monitor is at or just below the eye level, exactly opposite to the endoscopist. Let's look at upper Geoscope. So the patient is brought into the room, and then you go to the patient's bedside, you introduce yourself, you ask the patient to lie on the left side, and you pump up the bed, you position the monitor, and you give the endoscope without any loops on the umbilical cord, and it's perfect for the endoscopist to do the procedure without additional strain. Say for example, in the middle of the procedure, the endoscopist suggests that the patient need to be put on supine position, and it will require him to look to the left as the monitor has not been changed, and that would cause a lot of strain if it goes on for a while. You could ask the endoscopist if he would prefer to move the monitor right in front of him so that he could look straight and avoid straining the neck. And it makes it easy. So the same thing applies for colonoscopy as well. When we move the patient from left lateral to supine or right lateral, depending upon how the endoscopist is standing, you may want to consider repositioning the height of the bed or the position of the monitor, and that makes it easy for the endoscopist. So in summary, to do the best work, a lot of small details are important in terms of positioning the patient and equipment. The processor should be for colonoscopy to the left and back behind the endoscopist. There should be no looping of the umbilical cord of the endoscope. The patient should be at the right height, at or below the elbow level. Patient should be closer to the edge of the bed for those who do not put their scope on the bed. The monitor should be at or below the eye level, straight ahead from the endoscopist. And you should keep on watching and requesting your endoscopist if he wants to change certain positions of either the processor, the patient's bed height, patient's position, or the endoscopy monitor to make it easy for him and avoid unnecessary strain and injuries. Injuries are pretty common during endoscopy, and you could help the endoscopist by paying attention to these details. Thank you.